Hi everyone, excited to be with you again today. In today's episode, we are looking at the skills that can be helpful in your O.E.T speaking. Nursing skills that can be helpful in your O.E.T speaking role play. Of course, it's often claimed that the O.E.T exam is an English exam. Yes, for the reading, the listening, and the writing, it's just an English exam. But for the speaking, you need to apply some of your clinical skills that you learned from the College of Nursing that can help you to achieve the needed grade, A or B. Now, starting your role play, you need to put in your critical skills, your thinking skills, in your history taking, as this will help to provide a good framework in your decision making as regards your role play. Let's look at the introduction. You need to identify your patients by name, establish a good rapport, gain consent, be formal with your use of language, show respect, pay rapt attention to what your patient is saying. We all know that these are part of the things that are learned in the nursing schools. These are part of your clinical skills in your assessment or history taking. So you need to borrow this. And when you're going to start your role play, the interlocutor will never tell you to do an introduction. So it has to be a part of your cognitive thinking ability. Now, let's go to effective communication skills. You should permit the patient to explain himself in his own words. Why are you here? Why is your patient with you? Why is your patient seeking care? Of course, part of your skills, be an active listener. You need to obtain information with clarity, proper focus, goal-oriented, and concise, in the sense that don't make it too long when you are trying to get information from your patient. Try to apply paraphrasing to avoid repetition. Ask only questions that are relevant to your task, only questions that are related to the task you need to do as regards your role play. Of course, move from general to specific. Of course, you start with your open-ended questions, and this will help to explore more on the reason why your patient is seeking care. It will help your patients to elaborate and explain more about the challenges they are confronted with. And gradually, as the scene of your history taking evolves, you can shift to close-ended questions. Close-ended questions are direct questions. They are leading questions. And you need this type of questions, to address specific information. Like, for example, what time did you had the car accident? Oh, 10 o'clock in the morning. Those are close questions, just to give you a specific information, for example, as regards the timing of an accident. Do not forget that in your O.E.T speaking, your voice counts. So make sure you try to respond with your voice, with your verbal communication skills, because it's not a video recording. It's only your voice that will be recorded on tape. So your response should show in your voice. Okay, I see. Oh, sorry about that. Let it show in your speech, in your voice. And go through all this process systematic and in a logical manner. These are part of the things. These are part of our clinical training from the College of Nursing. Now, we want to look at explanation, the skill, the ability to give a clear explanation that will bring about understanding to your patients. At every stage, make sure you carry your patients along. For every process, procedure, or treatment you need to take, carry your patients along. For example, okay, we are going to start with this, followed by this process, and we end with this. You should try to offer a personalized nursing care plan based on the task in your role card. So let it be personalized. It's not like one size fits for all. No. Let it be personalized based on your patient's need. And give necessary information that will allow your patients to make an informed decision, because they are carried along at every stage, at every phase of the treatment process. And this will help to promote trust and build confidence in your nursing care. Now, these are part of the clinical communication skills that will be assessed in your speaking. Now, that is why I would say it's not categorically everything about English as regards the speaking in O.E.T exam. And you need to check for satisfaction and understanding. Give the patient opportunity to respond, to ask questions. Please, for example, you can say, please feel free to stop me if there's anything you are not clear about, or if there's more information needed as regards your treatment. So give room for communication, for response as you go about your O.E.T speaking. One of the special skills as a nurse is that ability to show empathy, to show empathy as regards your patient's challenges or problems they are faced with. Be empathetic with your therapeutic response. You should be able to demonstrate that you understand and recognize what your patient is going through. Your response must be free of bias. Try to show acceptance. For example, oh, I can see this is quite challenging, but let me reassure you that if you can follow the given advice, it will lead to a quick recovery. This is part of the ways we can show empathy to our patient. And of course, again, we need to give positive reinforcement for their efforts at following all the advice given to them. Oh, great, you are doing well. Excellent. Oh, keep it up. That sounds excellent. That sounds good. And lastly, we are going to look at your conclusive part of the speaking, your conclusion. Try to end in a friendly manner, in a way that your patient feels satisfied. You can summarize the points discussed in the conclusive aspect of your speaking if you have the time, but of course, try to make it short, straight to the point. And for example, you can end in this manner. Oh, thanks for your time. Bye for now. See you in the next appointment, or done this way. Oh, thank you for coming. If you need any help, feel free to call the hospital link if you need any help or guide. Thank you for today. Hope to come your way again with more tips. Bye for now.